Hello, hi, I'm Marianne, Woody Nurse Practitioner. I am happy to be here and welcome to Juva's virtual Girls Night In for COVID. The topic of my presentation is on Aerolase, my favorite laser. So I'd like to share my screen with you with a little presentation about that. So as we start the slideshow, we only have about 20 minutes on this presentation, so I'm going to try and talk as fast as I can from the very beginning and set my time so we stay on point. Okay, so the Aerolase topic is rejuvenation and beyond. I want to talk a little bit more about myself so you know that I've been a nurse for over 30 years and nurse practitioner for 22. And while I've worked in family practice in ER, my passion in dermatology started about 13 years ago. I am proud to say I'm dermatology certified. In the past 7 years, I've been a Juva in aesthetics. Um, to work at Juva, I became a laser expert and educator. I wrote the book on our energy-based devices at Juva. It's a clinical manual for safe device operation. I'm certified in aesthetics, and all of that is important because Aerolase is absolutely my favorite laser because I'm familiar with all of them. It's continuous learning for me in an ever-changing field. So the outline today is that I wanted to begin the topic of rejuvenation and talk about Aerolase, how it fits into everything we do to turn the clock back. And it's important for me to help you understand about this laser technology of Aerolase. What is it? How does it work? And why is it unique? There is a world of 30 plus approved FDA indications. And while in the short time I only have a chance to talk about acne, melasma, and skin rejuvenation with before and after pictures, there is many, and that's why I like about Aerolase. So modalities for skin rejuvenation involve topicals, toxins, fillers, peels, microdermabrasion, radiofrequency, and lasers. Aerolase, again, is a 1064 nanometer wavelength, and that is important, and I hope you understand why in the next slides. But what's also interesting and important about Aerolase is the 650 microsecond technology that this machine delivers a high power in a short pulse, and that makes the treatment safe, effective, and tolerable. So if you look at this graph, you'll see the thermal relaxation time on the bottom or horizontal. If it delivers the pulse so fast in milliseconds that it doesn't have the treatment discomfort of traditional laser technology. So the combination of the 650 microsecond delivery time with the 1064 nanometer wavelength allows this laser to target deep structures previously difficult to treat without damage. In this picture, you can compare the depth of penetration of the skin Aerolase on the left to different types of lasers on the right. And you can see that Aerolase doesn't have the treatment side effects and has the depth that's much deeper compared to other lasers. Because of the deep penetration of the skin, Aerolase Neo can effectively address targets in the epidermis and dermis. The ability for Aerolase to be so effective for a multitude of indications is because the laser targets three structures in the skin: water, melanin, and hemoglobin. By targeting water, we can help with fine lines and wrinkles, sagging skin, skin tone, and texture. by the target melanin, we can address age spots, melasma, post-inflammatory hyperpigmentation, and hair removal. And of course, hemoglobin, or the color red, is the target to help with acne, spider veins, angiomas, bruises, scars, etc. But what's amazing to me is Aerolase's safety in the skin of color, and has been continuously researched as published in professional literature. Not only does Aerolase have a wide range of treatment indications, it's literally my favorite laser for the safety to treat in all skin types. How NeoSkin or Aerolase Rejuvenation works is first, the laser energy is pulsed over the skin, targeting water to stimulate collagen. We do multiple passes. Next, we focus treatment addresses veins by coagulating cell walls, hyperpigmentation by clearing excess pigment, and redness by suppressing the capillary network. And gradually, as you see on the right, the collagen builds to smooth lines, tighten skin, unwanted veins, pigment, and redness will fade through the body's natural healing process. So you probably have some questions that I want to address before seeing a demonstration of Aerolase procedure. How many treatment sessions are required? And the answer is this can vary depending on skin and severity of whatever condition, but generally 4 to 6 sessions about a month apart are required to achieve good results. After that, maintenance every few months, depending on the skin type and/or condition, is possible. And do I need topical anesthesia? What about downtime? No, Aerolase is uniquely pain-free. A slight pinching might be felt at high settings, but in general, there is no downtime. The individual might feel a little warm that night of the procedure, but by the next day, be fine, no warmth, and just the skin might just be a little dry, needing some extra moisturizer. So let me see if I could get this demonstration of Aerolase to show. So the skin on this individual has been cleansed already, and as you see, that we do multiple skin passes over the area, and the individual is completely tolerant and having no discomfort whatsoever. So Aerolase provides comprehensive skin rejuvenation and tightening by addressing the most common skin aging concerns that I see in individuals at Juba. It helps with tone and texture, with fine lines and large pores, uneven skin tone, or rough-looking skin. Sagging skin is helped by helping wrinkles around the eyes, mouth, loose skin around the cheeks, jowls, and neck, and helps with veins, redness, and excess pigment. So if you look at some amazing before and afters of people using Aerolase to help tone and texture, tighten the skin, you see before on the left and after 4 treatments on the right, what a dramatic result this gal has had. It helps not only on the face, but also on the chest. Look at this before and after 4 treatments. And this picture, this is a 38-year-old that had excess sun damage in her youth as a lifeguard, and she felt her neck made her look older, much older than she wanted, and she wanted non-invasive treatment to improve her appearance. And she also had 4 treatments before and after. Let's move on to the condition of acne and how Aerolase provides comprehensive treatment by reducing sebum production and suppressing the inflammation, destroying the P. acnes bacteria, and reducing the formation of comedones or acne bumps. As an added bonus, the treatment helps prevent the formation of scarring, in addition to treatment of scars by stimulating collagen and clearing unwanted scar pigment. And again, I refer to it as post-inflammatory hyperpigmentation. So how NeoClear addresses the causative factors in acne in a single device, we see that it has deep penetration and it heats the sebaceous gland to reduce serum output on the left. It coagulates the capillaries to suppress inflammation and superheats the P. acnes bacteria to destroy the colonization. The pore unblocks and the skin on the right is now clearer and smoother post-treatment. Now some before and afters you see here that the after 3 treatments of Aerolase, before and after, you see not only improved clearance of acne, but help with the PIH or post-inflammatory pigmentation in this individual. Here we see a guy before and after 3 treatments, his acne much improved. And as well as in this girl, before and after 3 treatments with improved collagen and tightening appearance of her skin. He had a much more severe case of acne with papules and pustules and required a little bit more here after 4 treatments. Everybody's individual. She had 6 treatments before on the left and on the right better after 6. And I just wanted to share one more slide of acne. Here you have a worst case, papular pustule cystic acne that was improved after 5 treatments, and he shows a longer lasting treatment success. So what about NeoSkin for melasma? And NeoSkin clears melasma because it addresses both excess pigment in the epidermis and dermis, in addition to suppressing the capillaries involved in the inflammatory process. Let me take just a pause for a second to refer that clearance of melasma using Aerolase is also called NeoSkin. Management of melasma, and that is your clue word, by the way, to remember for our prices, NeoSkin. Management of melasma can be challenging, and if you know about that, if you're a melasma sufferer, you can know it's true. We use topical agents such as hydroquinone and chemical peels to help with the pigment in just the top layer of the skin epidermal layer, but results are often unsatisfactory because it just doesn't go deep enough and can cause significant adverse effects. NeoSkin addresses all the components of melasma in a safe and tolerable manner. It comprehensively clears melasma by removing excess pigment and the inflammatory process that feeds pigment formation. And here's some before and afters. This after 1 treatment, the same after 1 treatment, but what's important to note that we combined our treatment with a glycolic peel immediately after for the superficial pigment, and this patient had been previously unresponsive to other treatment options. A worst case of acne, of melasma, she required 2 treatments before and after. And this is another individual with a challenging case. She had 1 treatment, but also used hydroquinone, and other light-based devices really made her condition worse. NeoSkin for rosacea and veins. We have NeoSkin suppresses the capillaries involved in the inflammatory process by helping coagulate the vasculature hyperreactivity. It helps with the spider veins, papules, and pustules, and targeting the sebaceous unit to reduce excess sebum production and inflammation. What's so unique about NeoSkin for rosacea and veins is the erythema and redness usually required one prescription, but a separate second prescription was needed to help with papules and pustules with a different light energy for spider veins. So NeoSkin addresses all these three components of rosacea in a safe, effective, and tolerable manner. With some before and afters, we see this being a patient on our left with a mild case, and after one treatment, she had a worsening case with thicker veins of spiders on her face and required two treatments before and after. He had a variant of rosacea that's more pustules and papules, and he had two cases treatments as well as this patient went through treatments. So I did not get a chance to review all of the benefits of Aerolase. I highlighted some indications here that I wish I had time to review these challenging conditions like hair removal, warts, and nail fungus. But anyway, if you think you might be a candidate for Aerolase, I look forward to talking about it with you in more detail. So Aerolase can turn back the clock. It has numerous indications in summary, and it does provide a safe, effective, and tolerable treatment. And thank you very much for your time of sharing, and I hope to see you soon. Take care.